Now, so we've got the person diagnosed by going to the healthcare provider. We've started them on some treatment. And now it's a matter of you, the caregiver, continuing to learn as well. The more you understand about the disease process, the better you're going to be able to take care of your loved one. And the less frustrated you're going to get when they're having challenges. Now understand, here comes a tough one. This is a tough point for you right now. Because you're the closest to your loved one, you're usually going to be the one that they lash out at first. And they're going to not be appreciative. They'll get to the place where you may say you're doing for them every day. You call them, you're spending money on them, you're coming to see them, you're making sure they have groceries, checking on things. And the first thing they'll say was, "Oh, Mary doesn't do anything for me. She just comes by and she just fusses and she doesn't want to do anything for me." And it can be very disheartening when you know that you're doing all these different things for your loved one and they don't appreciate it. We all like to be appreciated. We all like for somebody to say thank you, say sorry when they've done something to hurt our feelings. Your dementia patient, your Alzheimer patient is not going to do that. I remember years ago when my grandmother, who used to take care of my grandfather's mother, and I was a young kid back then, and I can remember her frustration though. When my grandfather would come home, many times his mother would say to him, "Catherine hasn't done anything for me all day. I've been sitting here wet. She hadn't fed me. She hadn't done anything." And my grandmother used to get so upset because she was taking care of her mother-in-law hand and foot, changing her, feeding her, doing all the necessities of daily living for her. And I can remember as a young teenager, probably 11 or 12 or so, seeing that interaction. And that stuck with me as I've grown older and see the interactions taking place now. Very, very frustrating for my grandmother back then. And many of you caregivers right now, I'm sure you're having that same frustration. Because the more dementia your loved one comes with, and this is from like the beginning to maybe middle of the stage of dementia, moderate dementia, your loved one's going to not appreciate you. They're not going to give you any thank yous. They're not going to say, "Thanks for doing that. Thanks for helping out." They're just going to say, "Oh, why you do that? Why you don't like me? Why you want to do that?" And they're just going to argue with you, fuss with you. That's a tough time because we all like to be appreciated. And when they begin to do that, you're going to have tough skin, knowing that you're doing the best thing for them, for this loved one, to help that loved one. You're going to have tough skin. Once you get to the moderate stage, that kind of settles in because they no longer know that they're kind of coming against you. But in that early stage, they kind of do know, and you're going to know, and it's a tough time. But once they've gone through that, it's a lot smoother sailing once they've gone through that. But one of the things you need to do is constantly educate yourself on things that are related to Alzheimer's disease so that you can better handle those situations. Then one of the challenges in handling these different situations is now you're going to become the parent, and your mother or father, they're going to become the child. That's a tough transition because now you're going to have to take away some rights and you're going to have to take away some things they like to do. And that becomes a really tough part. Can't tell you how many conversations I have with family members, the caregivers, saying, "Well, mom likes to drive. Well, mom's still well, mom's real independent. Well, mom's had her house all this time. Well, mom does all this. Mom pays her bills. Well, mom doesn't like anybody getting in her business." Well, that has to change. And one of the things you don't want to do is you don't want to change it all of a sudden. Change it gradually. Because what happens is the last thing the senior wants to do is lose their independence. That's the toughest part of growing older, is to lose their independence. Understand that. I'm going to emphasize that. One of the toughest parts of growing older is to lose your independence. Be very, very careful that you cautiously and think about how you take away your parents' independence. Now, again, I said you're changing roles now. You're going to become the parent and they're going to become the child. Now, how does that happen? For example, I had a patient in my office, had a good exam with her, we talked, and I really didn't pick up Alzheimer's disease on her during the time of our exam. But as she was leaving the room, she said, "Doc, you know what? Every time I drive somewhere, I pull into the church parking lot to remember where I was going." I said, "Okay, come on back in here." And so we get her back in the room, and then I do some further evaluation and check her out. And I see that she does indeed have some dementia that I had not personally picked up yet. What I often do in that setting, because it's hard to pick up dementia when you're just interacting with the patient on a regular basis, you know, your 10 or 15 minutes in the regular office visit. Many times it's much easier if the family member, if you're suspecting something, come in with them or send a note with them to have us look for something specifically. Now back to this patient. I'm with the patient. Now I find out she does have some dementia and she's forgetting where she's going. Now if she's forgetting where she's going, that says to me that's pretty serious. She's forgetting where she's going. She may forget that a red stop sign means stop. She may forget that a red light means stop at the red light. She may forget that you don't turn right on red in some situations. And she'll begin to forget some of those rules. What I generally do in that setting is I call the family member. I say, I saw your mom today. Well, first I get permission. I get permission from the patient. Is it okay if I call and talk with your daughter, your son, your husband? And then once they give me permission, I call and talk to their loved one. I say, I saw your mom, your dad today. They weren't doing quite so great, and I think their memory is going downhill some. So we need to get them further checked out. But one of the things we definitely need to do is they need to stop driving, or they need to stop cooking, or they need to stop doing something that may be potentially hurtful for them. And that's very important that you think about their safety. As you're taking away their rights and as you're taking away their independence, think about their safety, and that will help make it a little easier for you. Because it's very hard to take your mother, your father's rights away, just like you would take a kid's rights away. Think about their safety. So what I would say to them is I think we need to really assess and evaluate this, because your mother tells me she's forgetting where she's going, and I think that's a problem. So one of the things you might want to do is you might want to take a ride with them, see how well they're driving. And if I say to that caregiver, you need to take a ride with them, they say, no, I'm not going to ride with them. Well, you already know it's past time you should have taken those licenses. If you are already at that point where you're saying, no, I'm not going to ride with my mother or ride with my father, their license should have already been taken. One way you can do that and not be the bad guy and not try to make the doctor the bad guy, you can say, Mom, they got a new rule out. And everybody at age 70 has to go have a driver's test. And that's not actually the rule, so you got to kind of push it a little bit. There's a new rule, everybody at age 70 needs to go take a driver's test. And you talk to the driver's bureau. So when they go in and take their written test and their driver's test, many times they won't pass it at that point. And so now the state can take away their license as opposed to you taking them away. That makes it a little easier and a little less conflict that you and your loved one will have, because you'll clash when you start taking away privileges like that.